After a 2-year hiatus due to the COVID-19 health crisis, the Africa Aerospace and Defense 2022 opened this Wednesday at Air Force Base Waterkloof in Pretoria, South Africa. The event is an opportunity for companies from across the world to work together. Countries like the US, Belgium and China will be present. Minister of Defense Dandy Modise presses the importance of the event for the country.
In South Africa it is very important. It helps us create jobs. Defense, it is one of the pillars, because if our defense industry is not there to support the defense, then we are in trouble. So it is very, very, very important.
During said event, the South African National Defence Force will put on a mini-war display, while the South African Police Service will also do a hijacking hostage rescue display, both typically involving aircraft, vehicles and simulated gunfire. The Aerospace and Defence Expo will run until Sunday, September 25th, with the first 3 days being trade days and the last 2 being air show days.
A show of might in Bamako and a statement that the army is still very much in control. At Mali's independence anniversary celebrations on Thursday, junta leader Assimi Goïta stood alongside his counterpart from Guinea. Security forces took part in goose marches as crowds cheered. There were also praises for Mali's new security partner, Russia. There were people here that over 10 years could do nothing. Instead of recognizing their defeat, they made up stories. As you know, it's Malians that are fighting for their land. We have Russian instructors here. We thank them. They are not mercenaries. At the beginning of the year, Bamako kicked out French troops in favor of the Russians. Moscow says its forces are helping Mali fight terrorism. Terrorism is a global threat which must be stopped. Russia will share its experience with our Malian friends. Long live Mali-Russia friendship. In both Bamako and Conakry, the army rulers have resisted regional and international pressure to leave power.
The Global Fund to Fight AIDS, Tuberculosis and Malaria raised $14.25 billion Wednesday at a donor conference attended by French President Emmanuel Macron as decades of progress against the diseases are set back by COVID. It was the highest amount ever pledged to a multilateral health organization. Victory against the great pandemics is within our reach, but we still have a long way to go. 38.4 million people are still living with AIDS, malaria and tuberculosis infections are on the rise in Africa, in the Middle East and Latin America. These are the realities we must face up to. We still have a lot of things to do in the coming years, and in 2030 we must keep our promise. HIV, malaria and tuberculosis must be gone. The French leader also vowed to continue to fight to lower the prices of drugs by investing 250 million euros over 3 years in the International Drug Purchasing Organization, UNITAID. I'm happy to announce that we will allocate an additional 300 million euros to the Global Fund over the next 3 years, which means that we will invest 1.6 million euros between 2023 and 2025. Since the Global Fund was created in 2002, it has saved 50 million lives and reduced the combined death rate of HIV, tuberculosis and malaria by more than half in the countries where the fund invests. More than 700 children in Zimbabwe have died from disease in an outbreak first reported in April. Many were unvaccinated because of religious reasons, according to the country's information minister. The government has announced a vaccination drive, but as with COVID-19, some religious groups are stubbornly opposed to the vaccines and have hindered the campaign.
The religion itself is a major problem because they've got a belief that if they get vaccinated, they become unholy. So that's the doctrine that they hand down to the women. But ladies, since they are under the men, they have no power to say no.
While some mothers have rushed to the Mbari Polyclinic in Harare to get their children jabbed, some have to be smuggled into the facility in secret. Secrecy is necessary because members found to have visited healthcare centers are shamed and forbidden from taking part in church activities.
We do encourage women to go and vaccinate their children secretly, maybe at night, because we have got some other churches, though they are apostolic, but they do not permit their children to get vaccinated. They might be sort of shamed or not allowed to participate in church activities, and they can just be just discriminated within the church.
Apostolic groups that infuse traditional beliefs into Pentecostal doctrines are among the most skeptical of modern medicine in Zimbabwe. First, we need to protect them with the Holy Spirit to cast out demons and bad luck. We remain the first port of call. Sometimes what happens is when you go to hospital, you will be told medicine is not available. While it's there, this is because you have bad spirit and bad luck following you. So we encourage people to come to church first to get anointed before you go to the hospital, because the Holy Spirit can open doors for you. There has been little detailed research on apostolic churches in Zimbabwe, but studies by the United Nations Children Agency, UNICEF, estimate it is the largest denomination with around 2.5 million followers in a country of 15 million.
Uganda on Thursday said it had detected 6 new cases of Ebola, raising the total number of confirmed cases to 7. A local daily on Wednesday reported that the death toll had risen to 12.
To give you a background, the epidemic appears to have started around the beginning of September, when people started dying in a small village in a sub-county called Madudu.
Health officials said the country will draw on its previous experience to counter the latest outbreak. They said COVID treatment facilities across the country would be transformed into Ebola treatment centers.
This current outbreak happens just at the end of the COVID pandemic, which we think we successfully managed. And much of the infrastructure that we used, both for COVID, we are quickly repurposing it to Ebola. But also of note, just as Patrick was speaking, we have significant capacity built across within the country for detection and also to be able to galvanize community support and response. So we think that using what we've done before, we should be able to appropriately respond to this current outbreak.
On Tuesday, the East African country confirmed an outbreak of the hemorrhagic fever in the central district of Mubende, about 150 kilometers west of the capital Kampala. Officials said vaccinations for frontline workers had begun.